Hello everyone, welcome to the scenario for post-hospital initial home visit. I'm Sharon Rayner and I'm going to be doing the training for this scenario. I want to thank everybody very much for participating, and this scenario will be a post-hospital. Actually, you'll be coming home from rehab after an acute hospital stay from a fall at home. So you've had physical therapy, and you'll be meeting with the family nurse practitioner students via video. So your name is James or Jane Adams. You're a 70-year-old-ish person. You live alone in an apartment in Horsham, Pennsylvania, and you're not happy about it, but you agreed to move there when your children wanted you to after your spouse died. It's okay, but you like your neighbors. You're a pretty social guy, but you're really not in a good mood today. You want to get the heck out of the rehab. So you are crabby. Your rehab disposition, you were delayed coming home, and so you're not happy about that. So you're a basically 7-year-old-ish crabby person that wants to get back to their home, their apartment. You have a daughter in Massachusetts and a son in Arizona. Your daughter is coming this weekend. She knows you're finally going to get home today, actually later today. She'll be there this weekend. You absolutely do not want anything to do with assisted living. If that comes up, you don't have to bring that up, but if you're asked, this is just to give you an overview of the character. You have a home health aide who you really like. She's there 6 days a week. And then you have, as you describe it, one of those things that I wear around my neck and calls 911 if I fall. And yes, you have fallen many times, but you really don't want to talk about that. It's no big deal to you. And that's as much help as you want. So if they, press you on anything like that, you want nothing to do with that. This scenario is that you were dizzy and fell, went to the hospital a couple of weeks ago, and they, quote unquote, meaning like the people in the hospital told you that you had a mini stroke, and that you went out of this rehab place like yesterday. Somehow something got mixed up with your transportation home. This is how we were able to do this by video. So you tell the NP that your social worker screwed it up and didn't get you out in time, and you've been stuck here another 2 days, and you are like really not happy about that because you've had it. You went out of this rehab. You don't recall any of the dates. So like if the student was to say, well, what day did that happen? They're already going to have a discharge paperwork from the rehab, so it has all the dates. They probably won't ask, but you just don't know any of that. You occasionally fall at home. It's no big deal. Most of the time, the medics just come and help you get back up, and you don't go to the hospital. You don't have dementia. You are a functioning, community-dwelling older adult. You're just miserable that you've been in this rehab and couldn't get home when you were supposed to get home. Now, this slide shows what the students are going to see about you on that discharge paper. Your date of birth is there, when you went to the hospital. You were diagnosed with a transient ischemic attack, which means, in lay terms, a mini stroke or, some kind of brain event. They may ask a lot of questions, and they may not ask a lot about the hospitalization because they actually have to, as part of this scenario, they actually have to request the hospital records. That's all because of like HIPAA, and they have to go through their agency to get it and all that. So we have that built in. I'm sorry, there's a typo on that slide, but that is, they'll have to request hospital records. Now, they definitely will ask about any past medical or surgical history. That is on their piece of paper as well. These are the things that you can tell them that you had a heart attack and you have stents. You're not sure of any of those dates. You had a stroke. You have some right-sided. Your right side doesn't work. That's what RT means. I should have spelled that out. I'm sorry. But your right side, arm and leg doesn't work, but you get around fine. Your prior doctor told you that you had diabetes, but you really didn't believe that, so you haven't been doing too much about that, but you do take your medications, like your oral medications. And that's really all you know about your history. You do have, you have had a right knee replaced a few years ago, and you've also had your gallbladder removed. And again, they're going to either ask you this or not ask you this, or maybe just ask to get a sense of like what you know about your past medical history. And you're not a great historian because you don't pay attention to that kind of stuff. That's not on your radar, really. You do what your doctor had told you to do, basically. So this is what the students will see on your discharge paper. You have a lot of things. So you definitely have diabetes, high blood pressure, high cholesterol. You've had a stroke. You have chronic kidney disease. You have osteoarthritis, and you are occasionally constipated. You have had the two surgeries I mentioned, the gallbladder and the right knee replacement. And then if they ask you anything else like social history, they may ask you about your daughter and son and where they are, and family history. If they get into that, there's really not much that you recall about any kind of past family history. But they will go and ask you more about maybe, some more personal things. So like you can tell them you're a retired high school English teacher, you retired when you were about 58, you just wanted to travel and enjoy yourself, you grew up in your hometown and you taught at the local high school, your spouse passed away a few years ago from cancer, you're supposed to be enjoying your retirement and traveling with her or him, and now I'm falling apart. So now you're like starting to think you're just miserable. You're in this place, you want to be home, you're crabby. You have a son who's an attorney in Arizona, and your daughter is a school teacher in Massachusetts. They both want you to move closer to them, but there's absolutely no way you're doing that. You're an independent person, independent thinker. You've grown up in Pennsylvania. This is your home, and you're not going to go anywhere. So you're very settled in your ways. So the students, before they see you on the video, will have a chance to have gone through your apartment. Your aides, until they're doing a safety scan. So they're going to look for hazards, trip and fall hazards, and things in your apartment that are unsafe. Your aides there, because of course you are coming home from the rehab today. So they'll tell you that, or you would just know that. So they'll probably ask you questions like, do you cook for yourself? They'll be worried about, how you get your food. So they may ask things like, do you cook for yourself? You say, no, I get takeout. You like Nick's, that's the local place. You just call up Nick's and, order whatever you want. The aide goes and gets it for you for lunch and dinner before she leaves for the day at 4:00. You still smoke. You smoke 1 to 2 cigarettes a day. You're definitely not interested in stopping if they start off with that right away. You could say, well, I cut way down. I used to smoke like a pack a day or whatever before your wife or your husband died, and you cut way back. So you're definitely not interested in talking about any more smoking cessation. Your aide goes and picks up the food and brings it to you and then leaves it for you. And you just tell her what you want, and then that's it. You really get a lot of takeout. You don't go to the grocery store. On rare occasion, maybe the aide will go for you and get a few groceries in the house, but basically not very often. You have an occasional beer or glass of wine. There's no history of heavy drinking or everyday drinking, anything like that. You never use drugs or any kind of substances now. You do have some hobbies. You like to read. You like to play cards with the neighbors. You actually like your neighbors. Most of the days you're a pretty sociable person. You like to sit outside on the patio and get fresh air. Even though you have a hard time getting around because of arthritis, you're still a community dwelling, well-functioning older adult. But today you're just absolutely not having any parts of this because you do not want to be in this rehab anymore. So you're crabby, but on normal days, you're a sociable and likable person. So if the student were to say, how about if you got meals delivered, like Meals on Wheels? Absolutely not interested. Grocery store, if they bring up healthier eating, healthier food choices, you don't really want to hear anything about that the first time they bring it up. Maybe you would be, because you are a reasonably nice person, you might say to them, well, maybe we can talk about that at some time in the future. If they ask you about your mood and depression, you say you're fine. You have no past medical or past mental health issues. You have no suicidal thoughts or thoughts of harming yourself or others. And you have no interest in smoking cessation or any kind of wellness discussion today. The only thing is on your mind is get me out of here. And, you're not a mean person, but you just really want no parts of this whole medical care anymore. You don't want to be in the rehab. You didn't want to go in the first place, like things like that. Now they'll have a whole list of your medications, and you just tell them that you take everything that you're supposed to take. You really don't have any ideas about what meds you're on. You can say things like, I know, they put me on a couple new things in the hospital, which they did, and the students will already know that. And you're in your apartment, they've already looked like at medicine bottles and things like that because they did that environmental scan already. So they may ask you some questions, but you really don't have any idea. You just take whatever they, quote unquote, meaning the healthcare provider, would tell you to do. They are always changing things. You can say like that, like, I was on this blood pressure pill and then I think they changed it. And you can say that when your knees really hurt, you do take Tylenol. That they'll see that you have Tylenol, and you take it safely, and there's no problem with that. If they ask you about allergy, you're allergic to morphine, you get itchy, and you develop a rash. Now, they will do some physical exam, even though this is going to be a video exam. So they may ask you to do silly things. So the TIA was like a brain or a neurological event. So they may do a neurological exam. So they'll ask you maybe to put your arms out straight, squint your eyes closed, puff out your cheeks, or anything like that. Whatever they are trying to get in terms of a physical exam, you could just go along with. It won't be anything that crazy or bizarre. You're going to tell them, they'll probably say, how do you feel? You're going to say, I feel fine. My blood pressure was good today. And you can tell them what your blood pressure was this morning because, of course, they checked it. And it's 132/60. You're definitely walking better since you've been in the rehab. So even though you want to get the heck out of there, it did help you. But they want you to use a walker, but you are absolutely going to be fine with your cane, which is at home, and you want no parts of that walker. But you are doing better and walking better, you feel, since you're coming out of the rehab. Couple other things they might ask a little more detail about would be like eating, like, are you eating okay there at the rehab? Like, are you swallowing okay? You would say yes. You don't have a great appetite because you can't stand the food there. It's horrible. You're sleeping okay. Sometimes you have some trouble sleeping, but it's not a big deal. And you can say that, that will get better when I get back in my own bed. They may want to know, they are seeing you for the first time as your new primary who's going to see you at home. And so you can ask them, how's this going to work? Are you going to be my NP or my primary? Am I going to see you at the apartment? Like, you can ask them how this is going to work. You haven't seen your regular doctor for about a year now because you just don't want to go in and spend your whole morning going to a doctor's appointment. You always have to wait. The doctor had kept refilling your medications, but they said that's it. You have to have an appointment or they're not going to refill your meds. So, so this is something new because you have a harder time getting around. Your family thought it was a good idea. Maybe have the home visits and get seen at home so you don't have to do that. And you can have regular checkups and visits. So that's how you're going to start this. But the nurse practitioner was going to see you in the apartment today, but you didn't get home from rehab in time. And so that's why you're doing this visit on the video. And then your aide's there 6 days a week, so she has Sunday off. And you absolutely want to continue with this. So even though the nurse practitioner is going to see you at home, that's it. You're not willing to change absolutely anything. You want that aide. You're not going to go live somewhere else. You are absolutely not going to change anything. The visit itself is going to be about 15 minutes on the video with the students. So the students are either going to be by themselves. Most of them are going to be with a team of 2 seeing you. There's one poor lonely student that is going to be in an odd number group, so you may have one. And if, of course, somebody doesn't come that day, there may be just one student, but typically there's going to be 2 students, and they can do it however they want. One student might ask questions, the other one might take the notes, however it goes is fine. We'll of course be in the viewing room, and so if anything seems strange, we'll knock on the door and try to intervene. The student has already looked at your apartment, as I said, for safety. They've done a safety check. You're going home today, which you can't wait to do. You had PT and OT, and they want you to use a walker, but you refused that. So you are okay if the student mentions that there's a walker there waiting for you, but you don't really think that you're going to use it. They may talk about your medications, like are you taking a lot of meds? And there's been several changes, and you say They saw insulin in your apartment, so you could say that I think they told me something about that, but I don't take it. But I do take all of my pills. All right, so that they may follow up because of what they actually saw in your apartment. And they're going to be in teams, so one might remember seeing something else. But those are the details about the apartment. Now, we told them you're going to make them very nervous because of the fact that, you're crabby today and you're coming home. But they may say things like, we're going to see you in a couple of weeks at the apartment, and you're okay with that. We're going to have close follow-up because you're not back in the apartment yet. And they sometimes, when you're first coming home, want to see you more frequently. They may also tell you that they're going to order the physical therapy and occupational therapy for you at home, and you're okay with that. So you say, okay, that's fine. I knew that was coming or whatever. And actually, you felt like the physical therapy did help you. And if they say that they're going to order speech eval, because that's on the paper from the rehab, they want you to have a speech eval. You can say, I don't think I really need to have that, but okay, I guess it's okay. And then you can agree with anything else they say. They may say a dietitian just because you tell them you eat at Nick's all the time, your favorite Italian place. And if they do, then you say, that's fine, but I'm going to eat what I like. So you can kind of agree with them. They'll probably give you some idea of what they're thinking and their plan for you. And you'll be okay with it because you do want to have the home visits. You just are very set in your ways, and you're not really going to probably be very open to change. So that is pretty much everything that I think they might ask you, or that whole scenario. I hope that gives you a sense of this person in the scenario. On behalf of all the faculty, I want to thank you for participating in our simulation program for the family NPs, and certainly reach out to me. I'm available by email. I put my cell phone here, and it's fine to text me if you want, if you have a question about anything I went over, or email me, or we could email as a group. I'm going to try to email this out to the whole group today, because I had to change the background on the slide. It was hard to see once I was going to put it into a video. And I want to make sure that I answer all your questions before Monday, but if anything comes up, I will be at the Dixon campus on Monday, so feel free to use my cell or reach out by text. Just make sure you tell me that you're one of the SPs, and I'll get right back to you. Okay, and I want to thank you again, and I look forward to the scenario. Thank you very much.